Here at AHA 2015 in Orlando, we have a variety of papers that are coming out of our NCDR, and one of them we're talking about here is outcomes of off-label use of TAVR, and it's in the United States, of course, insights from the STS ACC TVT Registry, and I am with Assistant Professor from the University of Washington, Seattle, and it's Ravi S. Hira. And first off, thank you very much for your time, because this is a topic, TAVR is one we have covered so much in the years. So you're taking a look specifically at, it's been approved, the off-label use.
Thank you for having me. Yes, so basically it started from, like everything else, just one patient, right, who had severe MR, and we were putting a TAVR in that particular patient, and go back to the label and you realize that's off-label. And going back and seeing how many patients we've done that don't quite fit the label of patients that had been tested in the partner trial or the core valve studies, to see which of these patients actually may still stand to benefit, even though they're not technically on label. So patients that we considered in our study were patients with bicuspid valves or unicuspid valves, patients with degenerating bioprosthetic valves, so valve-in-valve, severe MR, severe aortic insufficiency, patients with subaortic stenosis.
But there's a variety of things that have been used off-label. So what did you find? Because you've got a large database when you're looking at the NCDR.
Right. So the benefit of the TVT registry is that all commercially funded sites actually participate in the TVT registry. All patients that are undergoing TAVR, irrespective of the valve type, are included in this registry. And we had about 23,841 patients from 328 sites. And we included all the patients we could find, essentially, from the 9th of November in 2011 to September 30th, 2014, which is a pretty long duration of time. Including all patients, we found that about 11.2%, or 2,682 patients, fit the definition of off-label, and we wanted to know what their outcomes were. So we actually linked with 15,394 patients that were included in the CMS database, and found that in terms of mortality, patients had increased mortality if they were off-label at 30 days, but that didn't quite pan out when you looked at one-year mortality. Their outcomes in terms of mortality, heart failure, MI, and stroke were actually equivalent at 1 year between the off-label and on-label groups.
That's awfully encouraging, isn't it?
I would think so. I mean, these patients have in the past been excluded, like I mentioned in the studies before, but they still are patients that may be high risk or inoperable surgical candidates that still stand to benefit from newer technologies. If they don't get surgery, they need something, and medical therapy may not necessarily meet those requirements. And if we have devices which are available, we should be able to offer them to our patients. A word of caution, though, these are still off-label. They have not been tested, but even during the process of writing this paper, valve-in-valve ended up being approved and is now on label. So there are gradually more and more of these indications which are falling into the label.
And this particular data comes from the ACC STS TVT Registry.
Yes.
So we have a variety of NCDR papers that are being presented here, and I want to make sure that you know that we have a variety of them who are being reported in CardioSource World News and CardioSource World News Interventions, where I'm Executive Editor Rick McGuire.